Hi Grandma, so this is going to be our last video for the semester, and this week we discussed cardiovascular diseases, more specifically hypertension, which is high blood pressure, and metabolic syndrome. So since our family can relate to high blood pressure, I decided to focus on that today. So a little bit about blood pressure. As your heart pumps blood through your circulatory system, pressure is actually created. And this pressure increases when the heart contracts, which is called systolic pressure, and it decreases when it relaxes, and this is called diastolic pressure. So when you are measuring blood pressure, we are actually measuring the function of cardiac output and the peripheral resistance of blood vessels. As you may know, your blood pressure is optimal when your systolic blood pressure is less than 120 and your diastolic blood pressure is less than 80. So based on that range, you're considered to have stage 1 mild hypertension if your systolic blood pressure is between 140 to 159, and if your diastolic blood pressure is between 90 to 99. So you may be surprised to know that about 1/3 of all Americans have hypertension, which is a huge number. And it's also important to note that there are usually no symptoms to hypertension. In some cases, however, some people may experience headaches, blurry vision, chest pain, or frequent urination at night. However, in many cases, there are no symptoms at all, which is why it's really important to have regular checkups, especially if you do have a history of hypertension in your family. Um, so there are many causes of hypertension and risk factors, mainly being obesity, lack of exercise, hyperlipidemia, diabetes, having a high salt diet, stress, genetics, age, and sleep apnea. These are all risk factors of hypertension. So just a little bit more about the function here. Your blood pressure is normally regulated by the kidney, adrenal gland, pituitary nerves, and your behavior. And as you can see, this diagram here shows a little bit more about the functions of the kidney and how it affects your blood pressure and how your blood pressure rises. So in addition to that, there are several effects of hypertension. Eventually, after you've had hypertension for a while, you will experience such things as atherosclerosis, which is the hardening of the arteries due to plaque buildup, and this could eventually lead to necrosis or death of the artery. And in addition, you could also experience aneurysms or ruptures in the blood vessels. And in the heart, you could be more prone to ischemic heart disease or myocardial infarction. Or you can also, high blood pressure can also affect your kidneys. It can affect your eyes. And in the brain, it can cause a stroke or a hemorrhage in your brain. So based on all of these effects of what hypertension can do, it is really important if you have hypertension to try to reduce your blood pressure as much as possible. So the best way to do that is lifestyle modifications, most importantly being weight loss, regular exercise, which about 30 minutes a day, having a low sodium diet, and also having a diet rich in potassium and calcium, and also having minimal alcohol consumption. So these are all things that we can do to help lower our blood pressure and stay healthy. So thank you, and I'm enjoyed my time with you, and I will talk to you later.